Thank you so much, Dr. Rajbans, for joining us for this edition of Healthwise. Now, how are you feeling, Doctor? Good?
Very good. Yes.
Still at work every day?
Yeah, still have to.
Things
Patients
under
are always
control
there.
at the hospital?
All very well controlled. I mean, now we got the things going in, we all know the procedures to do, what are the things to do. Patients come with fever.
New norm.
New norm, special protocol, special thing to follow. I think the first few weeks everyone was confused, but now everybody knows exactly what to do. And, when do you wear a PPE or when do you wear just a mask and a gown when you don't have to worry. So it's all the protocols are there. Everything is there. So it's good.
So when someone comes in with a fever, you have to don on the PPE already? No.
We don't even see the moment it's a fever. They go to right to the emergency department, and they go to a special area, and then the doctors, the emergency doctor will see, and then they will call you. Then you have to go down, and then you wear you suspect COVID, then you have to wear all the gowns.
Any level of fever?
Yeah.
I mean,
yeah. Right now, until it's confirmed that it's dengue or it's some other bacterial infection, they go to a special ward until the COVID results come. We get our COVID in 6 hours, so very fast. So.
Oh, okay.
Yeah. What if they have Saturday night fever?
Whatever fever.
Now let's get to our first article that we found on the newspapers, which says that regular aspirin use actually reduces the risk of digestive tract cancer up to 40%. So, I mean, we were told that taking too much of these, pain relieving drugs, it's not good for your stomach, not good for your liver, not good for your kidneys, but it helps reduce the risk of digestive tract cancer.
Yeah, I mean, this was a study that shows that low dose aspirin does help to protect against, just like they help to so-called protect the heart, especially after, someone has got a coronary artery disease or a stent. They also found that while doing that, they also found that people seem to have less cancer of the bowels, the digestive tract. Now, I don't know whether that study has ever been repeated where other people have found the similar findings, but that showed quite a good reduction. Now, the thing is whether long-term, so when you take a low-dose aspirin, how long going to take? It's going to be lifelong because you can't stop. And once you get older, then the other problems come because low-dose aspirin has got this, like you said, effect on the kidney, the liver, and also can cause gastrointestinal bleeding. And what I find is that when patients are older, let's say in the 70s, 80s, they're on this blood thinner drug, they have a fall, they suddenly bleed in the brain, or they can get a bleed in the, the gut. So you look at the pros and cons of long-term, effect of aspirin on your other problems, other organs rather than just preventing cancer. And I think if you look at preventing digestive tract cancers, it's again back to a good lifestyle, no smoking, alcohol, cut down alcohol, have a high fiber diet, a lot of plants and veggie diet, a lot of prebiotics, probiotics. Also probably gives you the same effect and also make you healthier in all the other organs, So I think low dose aspirin, if you got a family history of cancer, you got a risk of bowel cancer, maybe then something to consider. But otherwise, normal people, I think long term, I would rather go for a healthy lifestyle, a healthy diet, rather than just low dose aspirin, because in your older age, you could have problems. So it's again something to discuss with your doctor. Now, if you're, let's say, a very strong family history of cancer, bowel, then maybe something to really think of.
Okay, so if you do have a family history of bowel cancer or digestive tract cancers,
yes,
it might be recommended to you to have.
Yeah.
To
So again, you have to
take
sit down and discuss with your doctor the pros and cons. Long term. So it's, maybe your gastroenterologist will do a scope and see. Yeah, you have a lot of polyps that can become cancer in the future, and they might remove some, but they're scared. So then you might think of discussing with him with low dose aspirin. But all this you have to really look at the long term pros and cons of which the best way to go.
But what does the aspirin do to your digestive tract that prevents the cancer from forming?
I think it's probably the anti-inflammatory effect that it has. Some anti-inflammation, which also can be, got through other ways, like we said, the healthy diet. So probably that's what it does, reduces the inflammation in the gut, and that probably prevents a mutation in the cancer bowel.
Okay. All right. Let's get to our next article. This new US research has found that getting too little or too much sleep could have a negative impact on asthma among adults suffering with the condition. I mean, I understand when you don't get enough sleep, your immune system will suffer, but how can getting too much sleep affect a person with asthma?
That's interesting because again, it's back to your immunity, isn't it? And we have seen other studies that of course, if you sleep less than 6 hours, your risk of getting chronic disease and dying is faster because it's like a stress. But interesting, they also found that people who sleep more than 8 hours also had a shorter lifespan. And I think one of the reasons they looked at was people who slept a lot were also people with mental health issues, more depressed, and probably these are the people who really don't take care of their health because of that underlying issues, and maybe that's why they are more prone for chronic diseases, more prone for early death, and maybe that's why the asthma comes in because they are probably just people who are just more anxious and stressed up. That's why they're sleeping a lot, because otherwise you won't be sitting down. And you find that people who get more depressed or people who got no purpose in life, they sleep more, because they don't know what to do. So I think it's that issues that probably makes them get worsening asthma, early death, chronic disease, because it's like already a stressed up condition in their body. So healthy people will have the 6 to 8 hours, and that's what they need.
Okay. So what are some of the other risk factors for asthma sufferers besides getting adequate amounts of sleep?
I mean, asthma is an allergic sort of a disease. You got a lot of secretion that come into the lungs that cause bronchoconstriction. So it's the same sort of a spectrum like your allergies, your sinusitis, your bronchitis, and so, I mean, if you're prone for asthma, I would really not smoke for one. That is going to make things worse. Avoid sort of allergens that are out there. And I think a lot of asthma people, asthmatics themselves know which are the things that trigger off their asthma. Now, again, it's an imbalance in their immunity. So the same spectrum that you do, keeping, having the right sort of sleep, doing the right sort of exercise, eating a very healthy sort of plant-based diet, no toxin, no chemicals, managing your stress. A lot of these asthmatics actually able to control. So it's again what you have to do, because I think every of the disease has a genetic component. So all of us are prone, but we know from epigenetics that you can switch off your bad genes, switch on the good genes, just doing the right lifestyle. So find out things that can make your asthma get worse, and then avoid those things and go into a healthy lifestyle. You probably can sort of not cure but suppress your asthma attacks.
Actually, Dr. Rajbans, speaking of asthma getting worse, that inhaler thing that the asthma users use, right? Does your asthma get worse? Because I noticed some friends going from one and then it gets stronger and stronger as they get older. Shouldn't they be getting better as they get older?
Again, they have not really managed to look at their whole by not getting to suppress that asthma attacks. So the underlying condition, see, the drugs that we give as doctors, they are all symptomatic treatments. They don't cure the underlying problem, which is the allergen,
Right,
hypersecretion. So steroids can sort of calm them down, but they don't cure you. And to cure you, you need to really rebalance your whole system, right? So these are all drugs that can just control the symptoms. They reduce the inflammation, reduce the secretion. But the moment you stop them, it's going to come back. So there's a lot of asthmatics have to, be very meticulous with their medication, their inhalers. We prefer them to use inhalers, but if you don't cure the underlying issue, which is all the other things, a bad diet, alcohol, smoking, pollution, stress, poor sleep, and all these other things, that are going on, the underlying problem is not settled. And if you, over time, it's just going to get worse and worse because the drugs are not curing you, they just suppress the symptoms. That's why over time you see that they end up taking stronger and stronger thing because the same drugs are not working as well.
So we also have to,
because I have a friend
asthma
who's
sufferers would
hooked on
have to,
Ventolin.
So the asthma sufferers would have to find out their allergen that will cause the asthma to trigger the asthma as well. Yeah.
And as they go into a healthier lifestyle and they avoid those triggers, they can actually get less and less attacks and over time get better instead of getting worse.
All right. Next one is pretty interesting. There was this test that they did on these heat-resistant plastic spatulas, and 5 of these spatulas actually failed to meet the standards set by the EU on the migration of primary aromatic amines or amines. PAA, which is a carcinogen that can cause bladder and breast tumors. I mean, doctor, can you please explain what is PAA and how does it cause cancer?
I mean, it's just a chemical, that has, they call aromatic carbons there with amine. And this is just a chemical that is formed. A lot of this is present in packaging materials, kitchen, plastic utensils. And when exposed to heat, they actually, some sort of chemical reaction occurs, and that's why you get the PPA. And this is, of course, this compound, this chemical compound actually can go and cause disturb your DNA, and this can cause mutate the cells in the body, and that's how cancer starts. Right? So,
I'm sorry, doctor. Can you repeat that again? You were in and out just now.
Yeah, these chemical compounds actually work on the DNA or disturb the DNA and of the cell, and the cells become mutated. So these mutated cells start multiplying, and the source cancer is formed. So any of these chemical compounds can actually disturb our cell's DNA, and that's why when the cells start replicating, they become sort of mutant cells, and then these cells become cancerous. And that's how most cancers form, because of some sort of chemicals or some irritation that disturb the cell DNA. And that's what this compound does. And so I mean, the best thing is avoid such things, or if using plastic utensils or packaging, make sure not exposed to very high heat. So that's when this problem will come.
Okay, so if it's ingested, this material, if it's ingested in high amounts, then it will disturb our DNA, sort of. But is this material found in almost all plastic items?
I suppose most plastics will have this. They say those are kitchen utensils, because most plastics, you don't expose them to high heat. But things like kitchen utensils, you're cooking with that, and you're exposing it to high heat, and that's when all these compounds are formed, because of the chemical reaction that's going on with the strong heat.
How about those plastic containers that are microwavable? How bad are those?
But I think if you look at the article, the heat they're talking of is actually quite high. So in the microwave, you might not be using such high levels of heat. I think it's cooking when you use a lot of high heat.
Yeah, this one, I think they did the boiling test. They put the plastic in boiling oil.
Yeah, so that's really hot, So I think microwave won't reach that level.
Okay.
But Dr. Rajbans, you're an advocate for everything going natural. I mean, at home, how are you cooking at home? Do you use a lot of plastics at home, or is it all like metal and the wooden spatulas?
Yeah, a lot of times it's wooden and some steel, this thing, but we hardly use plastic anymore. It's again how much you get exposed. I suppose we all can take in some, but you just have to be careful. If you're having all these plastic things going on, and then you're eating bad tires and you're exposed to a lot of other pollution, then it'll compound, and that's where you get the problems.
I'm going to get a flat rock, put it on a hot fire, and then I'm going to cook on rocks from now on.
Yeah, but I think it's all because of these plastic materials or utensils that we've been using. That's why there's so many cancer cases in recent years.
You can't run away from it, though. It's all over,
But I think this is one of the things. I think right now, if you look at the overall, the pesticides, the insecticides in our food, our water, the environment, plus things we're using at home, plus all the detergents and everything. So actually, you're exposed to a lot of chemicals, and I think that's why I feel that we slowly should go back to nature, at least in our diet and food. That will help, and slowly maybe in some of the things we use on our body and what we eat and all that and how we cook. So it's a slow process, but I think we have to start looking at it, because, like you said, cancer seems to be worse than the coronavirus. It's a pandemic.
Yeah. Actually, Bel, you and I were just talking about how much more plastic we have at home now because of all the food delivery, right? Yeah.
Yeah, that's right. Yeah.
All right. Next, let's get back to a little bit of COVID-19. There's been talks of this Kawasaki-like disease emerging from places with the pandemic, especially in children. First of all, doctor, what is this Kawasaki disease?
I mean, Kawasaki disease is actually an inflammation of the blood vessels that is seen in children, normally below 5. And until now, with the cause is normally unknown etiology. They get symptom that mimics like a viral fever. They get fever for the first 2 weeks, and then it doesn't get better. And then the second week onwards, they get things like vomiting, diarrhea, abdominal pains. And over time, if this is it won't get better, and then they get into inflammation of the, they get aneurysms in the heart, they got inflammation of the heart, and all these things can occur. They get arrhythmias and it can be quite fatal. And of course, the first 1-2 weeks, most doctors will be looking for whether it's some sort of infection, so they do all the tests for infection. But if they get everything negative, then they start thinking of whether you're dealing with the Kawasaki disease, and then they have to do things like echocardiogram to see whether the heart is dilated or the arteries are dilated, and that's how they suspect Kawasaki. Then the treatment is completely different. You don't give antibiotics or antiviral, you give immunoglobulins, which are very expensive, but which is the main treatment for this, to decrease the inflammation in the body. Now, surprisingly, COVID has got, whether it's Kawasaki or it's a Kawasaki-like disease, whether this virus has triggered off something, and we all don't know why some people get this Kawasaki, why some children get Kawasaki. So probably there's an underlying genetic part of it, and probably that's what's happening here. Some children are more prone than others to get the inflammation, and they get Kawasaki-like disease. And so we have to wait and see whether, because so far, very few children were actually getting problems with COVID. It was mostly the immunosuppressed, the elderly, chronic diseases. But this disease can be serious in children. So we hope this doesn't get worse.
So this is not exactly a virus. Kawasaki disease is not a virus like COVID-19 is.
No, but COVID-19 seems to trigger off a Kawasaki-like disease. So the virus
in children specifically,
children.
Right?
Yeah, so it's something different. But as you look at the whole COVID thing, we're looking at different symptoms that are coming up. I mean, now they recognize that loss of smell and taste is a sign of COVID, So, wow, that was something very funny for a virus. So things like that we are looking at and seeing new things that are coming up. So now Kawasaki-like disease is another thing that seems to be COVID. And I think over time, maybe other things will come out, but interesting. So I think today pediatricians...
The cases that we found with Kawasaki was in Italy, if I'm not mistaken. Have we found anything interesting in Malaysia?
Malaysia, no, nothing yet. I think Korea had some...
right.
It was Kawasaki, like Italy had. So, I mean, now all doctors, if you've got fever and it's COVID, they'll definitely be looking out for Kawasaki in children. That's something good about, that we can share all this information that, what we're seeing in other countries, we will know, and we can keep a lookout for that. So that's just the only good thing about this, that the whole world is coordinated fighting this virus.
Could this be like a strain of COVID-19 virus that affects only children, that
possible?
That gives them this Kawasaki-like symptoms?
Possible. Could be just that there is certain strain, because we know that the strains in US and Europe are most severe than the strains that were in Asia. So, and you don't know these strains this COVID, all viruses, they can change as they go along. So you don't know whether this strain is the one that's causing Kawasaki, and whether it will only happen there, won't happen anywhere else.
Can you pick up antibodies against Kawasaki?
You can get against the virus, but not against the inflammation part. The inflammation part is an entirely different thing that's going on.
So nobody knows the cause of Kawasaki disease yet.
Etiology suspected was one of the things was virus, whether it's a virus that triggers it off.
Okay. Yeah. But you don't know how children can get this disease.
Yeah, we don't know, because they just get this, and why they, whether what triggered it off, whether it's a virus, whether it's some gene, whether it's some toxin, we don't know. But now with COVID triggering it off, maybe it is a virus that we are not picking up earlier.
Interesting and scary at the same time.
Very interesting, yeah.
Because I do have children at home, and that's
I know, if you got young kids, you're always worried.
Age range, right? Yeah.
All right. Let's go to our final article for today. There's a study that identifies the gene that helps regulate cholesterol levels. So if this study is reliable, doctor, does that mean that if we can remove that particular gene, then we don't need to worry about having high cholesterol levels?
I mean, this is definitely a gene that runs in families. That's why we have that familial hyperlipidemia. I mean, these people have a gene where their cholesterol levels are really sky high, and you can't do anything about it but give them high dose medication. But most people don't have that problem because these are people you see in young people. Young people in their 20s, 30s, 40s have very high cholesterol, and they got all the problems that are associated with high cholesterol, and there'll be a strong family history. So it's not very common. Familial hyperlipidemia is not that common. Only certain patients, certain people have this. Uh, the one we find commonly is the one that most people have the high cholesterol, which is not a genetic one, but just lifestyle. You know, in your exercise, diet, and all those things. Uh, so if you can, in the future, we know we can look at gene editing, right? And if you can do that in the future, where you can actually see which people have genetic variants that can cause a disease, and I think a time will come when you can actually take away that gene for cholesterol and you solve that problem, right? Whether it's going to happen for other hereditary diseases, we are waiting to see. But they're already doing that. They're already able to do gene editing in certain hereditary diseases where we actually can sort of cure that problem. So, and I think this is coming. Future gene editing will come, but this will be for people who got a hereditary issue. Now, what about normal people who got gene variants, right? And I think that will be more. They won't do gene editing, but they'll probably more towards personalized. We call it personalized medicine, where we actually will look at your genes, look at your variants, and advise you the right sort of lifestyle for your body. Because actually, all of us are different. So, what diet you need, what exercise you need, what supplements you need might be different from somebody else. Like you and I or JD might be all different. So that's not the future. Future is going to be very personalized medicine compared to today, one medicine for all, right? So today, if you got a high cholesterol, you all get the same medication, but the future might be different because they might be able to say that you might need a different approach compared to somebody else. So that's exciting about this whole genome and the whole genetic makeup that we are coming, because the research is very exciting, coming very fast, and I think that future will be more towards personalized sort of medicine, preventive medicine rather than treatment.
Okay. But what I'm thinking is, if it is a gene, there is a gene in our body regulating our cholesterol level, does that mean that this disease is inherently hereditary and it's not a matter of lifestyle or diet, that kind of thing?
No, I think that's because only certain people have the gene that will get the familial part, but the
Okay.
rest of us have just got normal genes that are variants, and so we won't have that problem unless our lifestyle is not good. Right?
Oh,
So,
because I thought they identified that gene in everybody that everybody has that can control the cholesterol level.
but most of us will not have that problem because the gene won't be active. Only certain people will have the active gene. So these are the people with familial disease, and these are the people that actually will benefit from gene editing. The rest of us will look at how we can switch off that variance that will not cause a problem.
So how do you identify someone who has, is there any way to identify someone who has this particular gene? Because I understand people who have high cholesterol, they have different looks. It's not just because you're overweight, you have high cholesterol. There are some people who are extremely thin, but they also have high cholesterol. Is there a way
Once
to identify them?
you're familial, you can do whatever you want. Once you got the familial high lipidemia, you can look at diet, you can look at exercise, their cholesterol never comes down because there's a gene issue is right at your genes. So they need to go on real medications to bring it down. They have to break that whole cycle. But very few people actually have that issue. But I think this whole genome thing is very new. We're still learning a lot. And what I might be saying now, maybe in 5 years' time, will be completely a different thing that we have learned. So, these things with genome, your telomere, your stem cells, is all very exciting new things. AI is another thing that we're looking at. So, over the next few years, I think a lot of exciting research that we have to wait and see what happens.
Wow,
Solve the cholesterol problem.
AI in the
So it's
medical
coming.
field, huh?
Yeah, You read this book, The Future of, how the future is coming very fast by this guy called Peter DiMartisi. He talks in the year 2030, you're going for an operation and you see a surgeon and you scream because you don't want the human, you want the robot. Because studies have shown by 2030 that the robot is much, much more better than the human.
Wow.
And that's coming. And it's only, we're talking of 10 years away from now. So it's going to change everything. The AI is going to change. In the medical field, it's definitely going to get affected.
So are you going to risk losing your job to a robot
Definitely.
then, doctor?
Already today they have done studies in China, in England and America, where a patient comes into the emergency department, they talk to an AI, they talk to a doctor, and they talk to a nurse. And the AI is all the time beaten the doctor and the nurse in getting the right diagnosis. Because the computer has got no limit. They can look at from your symptoms, they can search anything and they can come up with a diagnosis better than a human. So yeah, I think 10 years from time I better retire because
So 10 years from now, Bel and I will be doing a show. It's Health Wise with Dr. AI.
AI, yeah. The AI will be smarter than all of us.
Oh no.
All we can have is a human touch.